Hi Dr. Sandeep. My friend has been advised Sentinel Lymph Node Biopsy for breast cancer. Is it safe?
As we were talking about the various concepts of surgery in breast cancer, we had discussed about the armpit lymph nodes. It is very important to remove the draining area lymph nodes in any cancer because that is a part of the completion of surgery. So when we remove these lymph nodes in the axilla or the armpit, one problem arises. The axillary lymph nodes also drain the arm on that side. So suddenly, because we are removing these lymph nodes in the armpit, there is a risk of the arm swelling up. Whichever side of the surgery, the arm on that side can swell up because the job of these lymph nodes is to drain out or suck out all the fluid in the tissues and push it into the blood vessels. Now, when these lymph nodes are not there, so because we remove these lymph nodes, there is a risk or the lifetime risk of the arm swelling up. Lifetime means, in your lifetime, your entire leftover lifetime, sometime the arm can swell up. The incidence of this or the percentage of this is about 40%, 40 to 50% you can say. So that is the risk if we remove the entire lymph nodes in the armpit. So what have we come up with? So the scientific community over the years have thought about it and has made a plan as to how to avoid this kind of complications. So to avoid this, what do? We have developed a technique called Sentinel Lymph Node Biopsy. In this, what we do is we inject some kind of a chemical or a dye in the area of the tumor or around the nipple of the breast on that side, and look for these lymph nodes which drain this particular breast. These are lymph nodes which are called as sentinel lymph nodes, and we remove only those sentinel lymph nodes and send it for testing. There are places in the world where they don't even do what is called as frozen section, but in my practice I always do the frozen section to see if these lymph nodes show any cancer, and if these lymph nodes show some cancer tissues, we need to complete the armpit dissection. In those patients where we don't complete the armpit lymph node dissections, we reduce the risk of them developing arm edema by at least 50%. So we want to give this advantage to every patient with breast cancer, even those patients who have had lymph nodes prior to the chemotherapy or what is called as neoadjuvant chemotherapy, prior chemotherapy before surgery. Even in those patients, we try to give this advantage so that their risk of developing arm edema is reduced. Of course, there are times when we cannot offer it. That will be discussed with you at the time of when the doctor discusses with you about these surgical options. Overall, there is a great benefit for the patient in their lifetime by opting for sentinel lymph node biopsy. There is one more advantage which is very often not discussed openly. When the patient undergoes sentinel lymph node biopsy, even the pain which is associated with the lifting of the arm, which is seen with the axillary lymph node dissection, is less in comparison. So there are many advantages, small advantages like this, which makes it better for the patient to go for sentinel node biopsy.